Hi guys, so I'm really looking forward to doing the online courses. So just want to show you what you actually get when you order the box from us. Okay, so within the box, we're going to have one fill bioceramic cement. So this is an absolutely fantastic bioceramic cement that I've been using for 2 years now. So the advantage of bioceramic sealer is that it's dimensionally stable. It doesn't shrink. So because it doesn't shrink, it means you don't have to worry like the traditional sealers that you're trying to pack lots of GP in there. So in a way, the more sealer you have and the less GP, that makes it much easier to use, and your workflow will be much more efficient if you do decide to use a bioceramic cement. We're going to have two file systems available. So one is the VS Flexi Gold, which is a constant 04 taper system. That's quite an easy system to use. So if you're a beginner, this might be a nice one to try and start to use a controlled memory file. If you'd like to do some more advanced endo, then we also have the VS Flexi VT system. So the advantage of this system is that it really saves a lot of pericervital denting. So we'll talk you through the exact techniques that you need to use on this. So in terms of models, so loads of kind of teaching in the past is just done on plastic blocks. So in this case, we've actually used a very difficult tooth. So it's a double curved tooth. So it's got an S-shaped canal. So technically it's quite difficult to do this. So the reason we've chosen this is it just can show exactly how flexible the files are. And it's nice if you can do a really challenging case. It means that clinically, when you're doing your normal routine cases, you'll be able to manage them a lot easier. The 3D tooth comes with a model base, so you won't actually be looking at the curves as you're instrumenting it. You can literally just press that into the base and you'll be able to work with that using the protocols that we'll describe to you. So you're going to have three 3D printed teeth, and there'll be 3 exercises that we're going to do on the course. Also, we're going to have Reflex irrigation needles. These are really flexible needles that can bend. They've got a 30 gauge tip so they can get deep down into the canal. We have a complete video on the use of Irriflex that we'll include in the course as well. And the last 2 things is we've got medium fine good aperture points. So rather than using constant taper points, for difficult cases it's really useful to have these GP, so we'll explain how to use them. And we have some sterile paper points as well. So all this comes within the pack that we're going to send out to you. What you'll need to provide is an ENDO motor. So the motor I use most often is the Black AI motor. I like it because it's wireless, it's got increased speeds up to 2,500 RPM, it's got a very small micro head which is good for patients with limited opening, and it's completely open source, so you can set this motor for use with any file system that you like. The other thing you'll need to use is just size 8, 10, 15 and 20 and 25 hand files, so you just have those ready as well, and just some kind of needle that you can attach your Irriflex onto, and just some liquid, so you can use water, saline, or if you want to use a colored dye you can use that as well. Ideally use a heat source as well, so that once you've placed the GP into the canal you can just heat the top part and pack it down coronally. So whatever you normally use in clinic you can use, but they are the additional things that you need to provide. If you have any other questions, or if you have some of the materials that we have in the kit already, just let us know and we can custom make the kits that we send out to you. The sealer and the GP and the paper points, you'll be able to use those in clinics afterwards. You're not going to be using up all the materials that's there. If you want, you can send us back the base and we'll refund the cost of the base to you as well. And if you have any other questions, please let us know. Looking forward to seeing you online. Bye.